Hello, I'm Andrew Kaunitz, Professor and Associate Chair in the OBGYN Department, University of Florida, College of Medicine in Jacksonville. Today I'd like to discuss with you our patients' declining options in terms of choosing trial of labor and vaginal birth after cesarean, or VBAC. It's old news to most of you watching this video blog that our patients who've had a prior cesarean delivery and who may be receptive to or highly motivated to pursue trial of labor and VBAC are facing declining options. Of course, one important reason relates to our hospitals, particularly those hospitals with medium-sized or smaller obstetric services face challenges in providing adequate neonatal and anesthesia coverage to meet requirements for trial of labor and VBAC post-cesarean. We obstetrician gynecologists face our own challenges. Malpractice premiums for obstetricians who choose to offer trial of labor and VBAC have gone through the roof in many cases and may be unavailable in others. And in addition, we need to be realistic and recognize that the amount of time it takes an obstetrician to remain in labor and delivery at bedside during a trial of labor is much more in terms of time consumption and time away from the office or family than the time involved with a scheduled repeat cesarean delivery. Of course, there are consequences for our patients in addition to the lack of ability to choose route of delivery for appropriate candidates for trial of labor and VBAC. We recognize that cesarean section involves more post-op pain and a slower return to normal function following surgery. We're also aware of the ominous trend of increasing rates of placenta accreta and other placentation disorders associated with higher cumulative numbers of cesarean deliveries in our individual patients, and with placenta accreta and related disorders, an increased risk of catastrophic problems associated with cesarean birth. In the 80s, we faced pressure to move away from the once a cesarean, always a cesarean policy, and we moved strongly in the 90s towards offering all appropriate candidates a trial of labor and VBAC. Now in this decade, we're facing pressures in the other direction, and in fact the pendulum has swung back to a policy in which too many of our patients do not have the option to choose a trial of labor and VBAC. And I think that's inappropriate. This is a complex problem and there are no simple solutions. But if payers, if insurance companies would start to recognize the tremendously increased time commitment involved in managing trial of labor after cesarean delivery compared with scheduled repeat cesarean delivery, that could go a long way to helping move the pendulum to a more moderate direction, back towards the middle. Our patients deserve nothing less. Thank you.